Okay, so welcome to my rhinoplasty video. I decided to make this video because when I was doing some research on getting rhinoplasty, I was all over YouTube. I watched so many videos and I'm basically creating the video I wish I had seen. A lot of it was really helpful, but there were some questions that I had and those weren't answered, so I really wanted to put everything all together and talk about my experience. So the very first thing is I want to tell you how old I am. I think that that's kind of important for the whole healing process. So I was watching videos that some people were a little bit younger than I was. Well, they seemed younger, I don't know. So I just didn't know how I was going to heal compared to them. So I'm 30 years old. 30 years young, you know. And so yeah, right off the bat, I'm 30. All right, so I have this list of things that we're going to talk about. So I'm 30 and I have wanted a rhinoplasty probably since I was about 10 years old, which is insane. I kind of always knew that my nose was just like a little bit too big for my face. I still loved myself and I still thought I was pretty and I thought I was cute, and it was just a decision that I wanted to make that little change. Now I waited a very long time because I wanted to make sure that this decision was the right decision for me. I wanted to make sure that I wasn't making it for anyone else. I wanted to make sure that I wasn't making it because I wanted to be a model or a superstar or anything like that. I wanted to know like this was for me fully. So at 30 I was like, yeah, I still want a nose job, so I'm gonna make that happen. So I did what probably anybody would do. I started Googling doctors. I was personally looking for a doctor who had like a specialty in rhinoplasty. I didn't want just any plastic surgeon. I didn't want someone to go from doing boobs or a tummy tuck to then working on my nose. I personally love when someone specializes in something. That's why all of my tattoos look very similar. So it's a whole vibe, so it just like looks better. I don't know, I feel like you can't be a part-time brain surgeon, you know, so it's better to have a niche. So I would definitely suggest doing that. Now my doctor specifically, when I was looking through his work, I noticed that his rhinoplasties, they didn't look like rhinoplasties. They didn't have that plastic look. They looked very natural. And I think that he really makes sure that the nose fits the face appropriately. So that was a definite deciding factor for me. And I did choose to get a rhinoplasty, obviously for aesthetic reasons. My nose was a little bit big, but I also did have a deviated septum. I'm not going to say that that's why I got a nose job, but I was like, hey, if you're in there, maybe you could fix some stuff up. So yeah, and that's just when the septum is just a little bit off. Okay, so that was basically how I decided. I also decided based on the fact that my plastic surgeon had a lot of videos of himself. I was able to kind of like see his style and how he was as a person. And then my decision didn't stop there. I also had a good experience in terms of like making an appointment and having a consultation. So when I went in for my consultation, my doctor put the mirror in my hand and said, hey, you tell me what you want to change about your nose. And now I personally got a rhinoplasty because I had 2 bumps along the side and my nose was just, it was like kind of big. So I had a bump, and then when I smiled, it kind of like came down. It was a whole situation, which I was cool with for obviously 30 years of my life, but I just wanted that little change. So when he put the mirror in my hand, he asked me those questions like, what do you want to change? I let him know and he said, yeah, I agree. I think that that would be a really good change. He said that his style is very, he wants to go for the untouched look, and he performs basically there's two different types, and this is also when I was looking for YouTube videos, like I wanted specifically to know how healing it was for a closed rhinoplasty. So there's open rhinoplasty and there's closed rhinoplasty. I'm not a doctor, don't take my word on this, but open is when they actually have incisions on the outside. So like let's say they cut this whole thing and you'll have scars here, and closed is when they do all the work on the inside, all your stitches and everything's in there. So I got a closed rhinoplasty, which meant obviously all the scarring is up there, which was good for me. That's exactly what I wanted. So the plan was to get in there and to basically file down my nose bridge, that way it was nice and smooth. And also he put this little piece in here that gave me some projection, some tip projection is what it's called, and that brings my sides in a little bit. So when I was thinking that, oh, I have a rhinoplasty and my nose is a little bit big, they're probably gonna have to like cut this or something. I don't know how it works. He didn't have to do that because he put that piece in, and once you put that in, it brings the sides closer together. I'm gonna show you, so basically I have videos from my Instagram. I decided to keep my Instagram followers like very much in the loop of what was going on. I love Instagram stories and sharing, so I didn't want to just one day pop up with a new nose and be like, yep, no problem, no, you know. So all of the video clips that I had taken are from my Instagram stories. So I had decided to get a rhinoplasty sometime in the winter, and then my actual rhinoplasty date was scheduled for February 4th. So currently I am almost 2 months post-op, which is really kind of awesome. Now this final look isn't exactly how it's going to look because swelling goes down over the course of the year, mostly in the first 6 months, but so far I'm very happy with it. So I wanted to update everyone. I officially sent my email for moving forward to get my rhinoplasty. I picked a doctor. I love his work. I had the consultation, and now we just have to pick a date soon, so I'm so excited. Next step is legit picking out noses. So if anyone has a nice nose and wants to send it to me, thinks it'll look good on my face, let me know. Basically, I didn't know if I had to show my doctor a nose and say like, hey, that's the nose I like. I never showed him a nose. I told him what my concerns were. And also a lot of people asked, one of the main questions that I received was, could you see what your nose is going to look like? My doctor doesn't do that. He said that computers don't do plastic surgery, plastic surgeons do. So it's really difficult to give you like a doctoring of what your nose is gonna look like. And I was totally fine with that. I trusted him. I looked at all the reviews, I saw the videos, and I felt pretty confident in his work. Okay, so pre-op. So you have to answer all these questions about your lifestyle. So if I was a smoker, if I was a drinker, how often did I drink, was I pregnant, all these different questions you would have to fill out. So I did that, and then I had to go for a pre-op a week beforehand so that I could be given the okay for surgery. During the pre-op, they give you like an EKG, they check your heart, they check like just everything that's going on. It's basically a physical, just to make sure that you would be okay for surgery. They also give you a blood test to make sure everything is good, make sure you're not pregnant, because you probably shouldn't have a nose job when you're pregnant. And they gave me a whole list of medications and foods that I needed to avoid 2 weeks before and 2 weeks after my surgery. All of these medicines and all of the foods were blood thinners, so you don't want to have thin blood when you're going in for surgery. So that was a big thing. I couldn't have ginger, I couldn't have vitamin E, I couldn't take ibuprofen, and I was a little sick like within the 2 weeks before my surgery, and I couldn't take ibuprofen, so that was frustrating, but I dealt with it and it was fine. So the day before my surgery, so I went to Target to pick up some stuff that I'll need, in my opinion, for my surgery tomorrow, and I'm gonna share it with you. But right now I feel really excited. Oddly, the thing that I'm like nervous for is getting an IV, because I don't like needles, and having to take pills after, because I also don't really take pills. I made sure that I had my prescriptions that my doctor had prescribed for me, and that was antibiotic, it was painkillers just in case, and something for sleeping. So I had those prescriptions, and some other things that I had purchased were arnica pellets, which were very yummy. And the arnica pellets, you don't need a prescription for that, you get that in any drugstore, and basically it's to help reduce swelling and bruising. So I had those. I bought a humidifier, which was so helpful, you have no idea. I had this lip mask, which I have here. It's a lip whip. This is by Cary Grant. And the reason why I had all these things is because I watched all these YouTube videos, and all of them, the girls were like, oh, my throat was so dry, their lips were chapped, their skin was dry and kind of gross, and I just knew that I was going to be very uncomfortable if I had to deal with that. So I made sure to have a super good humidifier. And this lip whip, my lips weren't chapped the entire time, and that was like the main concern. I saw so many YouTube videos where girls, their lips were like bleeding because they were so dry, and this was, I bought a brand new one because I was like, damn, this is good. But it was empty by the time I was done with it. So this is my brand new one, and I'll link it if you'd like. Oh, I stocked up on Essential, so water that had electrolytes in it. Yeah, I had a neck pillow, essential oil, so all of those things that I needed. I don't know if you can hear that. All those things I needed for a post-op. Oh, I should also mention I'm from New York. I live in New York, so I had my surgery in the city. My surgery was, my doctor has an outpatient facility, so I didn't have to go to a hospital. It was just all within his office, which is really nice, because it was like a little mini hospital in there. Okay, so the night before surgery, I couldn't eat past 12 a.m. I went into surgery the next day. I was scheduled for 11. I didn't get taken in until 12:45. I'm not sure why. Maybe they keep a buffer, I don't know. But I was like kind of starving. Oh, okay, that's what I wanted to mention. So the morning of your surgery, you have to take a shower and wash your hair and your whole entire body with antibacterial soap. And then you cannot put anything on. You can't put perfume on, you can't put lotion on, you can't put any face creams, you can't put anything in your hair, like nothing. You just have to be basically like bare with antibacterial cleansed skin and all of that stuff. So, excuse me. So the morning of my surgery, I went in. I was like not that nervous. Okay, so this is me pre-surgery. I am going in 1 hour, and I'm really hungry right now. So yeah. I was honestly more nervous about getting a needle in my arm because I don't like needles. I know I have tattoos, but it's really not the same thing. So I was nervous about that. The anesthesiologist came in to speak to me before everything. I spoke to my doctor beforehand, I spoke to a nurse beforehand, right before I was going to be taken in. The whole surgery, I think, took about an hour and a half. I'll kind of like explain in my Instagram stories.
Hi, so I just want to update you. I had my surgery around 12:45ish, and I was picked up like 3, right? 4 p.m. So I guess it took a little bit longer. It was obviously an aesthetic thing, but I also have a deviated septum, so he went in and he fixed that too. And I feel absolutely no pain. I feel like some feelings in my nose, but I think it's the blood. I've had to change this a couple of times, which is like the gauze drip pad. And yeah, now I'm just watching TV. So I am taking these little like pellet things. It tastes like sugar. It tastes like candy, so it's good. That's supposed to help with swelling and bruising, which I obviously have a black eye, but.
So I wanted to tell you guys what surgery was like right before I got taken in. Basically, right before surgery, they like asked me all these different questions, just to make sure like I wasn't drinking alcohol beforehand, taking like specific medicines that I wouldn't be able to take, and all that sort of stuff. And then I walked into the surgery room, and then the anesthesiologist was like trying to like put the needle in my arm, and he couldn't really find my vein. So it was a little uncomfortable, but the nurse was so sweet. She was like holding my hand, like, it's okay, no problem. And then he said, the anesthesiologist said, hey, I'm gonna give you something just to make you a little bit loopy, but like you're still gonna be like up. I was like, okay. The nurse was like, let me give you some oxygen. So she puts like the mask over my face, and I was like, there's nothing coming out of this. She's like, yes there is. And then bam, I woke up like on the other side in recovery.
When I came home, I guess I was a little high from the anesthesia, but I wasn't in pain at all. In fact, I didn't have any pain the entire time for my surgery, which I thought was insane. And I also want to stress that like my pain tolerance isn't high. Like I just did my nails 2 days ago, my arms hurt from doing my nails. Just to put in perspective of like what my pain tolerance is like. When I came back from surgery, I had my brace on, and then I had a cotton catch pad. It was just like to catch all the blood that was coming out. That had to be changed pretty frequently, and for the first like 4 days I had my husband change it. I didn't even want to look at it. So I had my husband change the cotton pad the entire time while he was here, and then he went away. He was on a trip, so I had to change it myself. And this is a video of me changing it myself, seeing what it was like for the first time. I was nervous to look.
Okay, so I haven't been cleaning, well, I haven't been taking this off because I've been having my husband take it off, so I haven't actually seen underneath my nose. So I'm a little nervous, and this is me just trying to not be alone in this world. I'm gonna keep it high. Oh my god, I'm so swollen. I feel okay though.
Your nose is going to be elevated. It's going to look like a pig nose. I don't know this for everyone, but it seems like that's basically the commonality. That's the most what happens. I don't know. That's just what I think. So at first my nose looked very like piggy, is very elevated, because remember, there's something in here. And it takes time for your skin to just readjust over this new form of your nose and your tissue and everything like that. So I thought that was like a little bit, you know. So the first day I wasn't too bruised.
I don't know, is this pale? Until my fucking eyes are bruised.
And then the next 2 or so days I was very bruised. My eyes were black and blue.
Okay, so basically the most uncomfortable thing visually, I feel like, is like just the swelling of my cheeks. I feel like I have a nose clip on, but I can still breathe, so it's kind of like an interesting feeling. I'm actually surprised how much water I can actually drink. I didn't think it was possible. And I kind of want to like adapt that into my everyday life. So my skin actually hasn't been bad, which I was afraid like not being able to wash it was going to be terrible. Yeah, so I'm still bruised. This yellowing is like the bruising coming down, and just like going back into my skin. It's my morning update for you guys.
And then the swelling just kind of starts to go down. And I don't mean go down, I mean it starts to physically move down her face. So my cheeks were very swollen at one point. It was kind of crazy. After 5 days, I saw my photographer and I had a photo session scheduled, and I was very nervous about it. But basically this photo session was 4 best friends from all over the country. They came together for one of their friends' like bachelorette party, so they wanted photos, and I knew that it was going to be really hard to reschedule. So I made it work, and I went outside with my nose and looking all crazy with my black eyes, and that is the video that's in here. I felt okay, honestly. Like, I wasn't in pain, but what I did do is I brought a friend who's also kind of just acting as my assistant. That way, in case I didn't feel well or in case I got confused or something, I just didn't know, so I wanted to have that plan in advance. And all the girls had a really great experience, so it was cool. The other thing that I was really nervous about with getting a nose job was sleeping sitting up. I had read that you can only sleep sitting up for like 3-4 weeks, and you couldn't wash your hair and you couldn't wash your face, and that was stressing me out. Like, I wasn't really afraid of the pain, I was really afraid of not getting good sleep. I was so nervous. But I spoke to my doctor, and he said, don't worry, you could definitely sleep on your back, just sleep a little bit elevated. I had a neck pillow so that I wasn't just like flowing over to the side. And then what really helped is I put a pillow underneath my knees while I was sleeping. Now, I always feel like mind over matter is everything, so what I did, because I'm a side sleeper, I like to sleep on my side, sometimes I'll even sleep on my face. What I tried to do is imagine myself in a first class lounge, first class seat, and laying down. And I kept thinking to myself, alright Amanda, if you were on an airplane, this laying down situation would be your dream, so just imagine you're on first class. So I did, and I was able to sleep really well. So I highly suggest, just imagine you're in first class. So 3 days after surgery, they end up pulling, so basically after your surgery, they put these like cotton swab things in your nose to like just basically catch all the blood. 3 days afterwards, they take them out. That was probably the most uncomfortable feeling of the whole entire process, but it wasn't really a pain. It felt like a burn, like a fast burn. like someone just like lit a flame in my nostril. And that cotton thing was like this big and it was just stuck up there. Once that was out, I was able to breathe normally, which is really weird that it was so easy, but I was able to breathe. I wasn't super congested or anything like that. And then 7 days, 7 days post-op, I got my splint off, which is crazy. Okay, so 7 days after surgery, I was able to get my splint off. It was obviously still swollen. It's still technically swollen as it is, but it looked like a normal nose. I had went out to an album release party the night that I got my splint taken off, and I couldn't drink. You can't drink alcohol 2 weeks before, 2 weeks after. And I said to someone like, oh no, I can't drink because I just got a nose job last week. And they were like, what? Like, you got a nose job? They didn't even believe it at all because it didn't look like I got a nose job, which I was like, yes, that's good. In hindsight, you know, I thought it was beautiful. Of course, I feel like we should always feel like we're beautiful. But when I look back on the pictures and video before my nose job, I was like, oh wow, it was really big. I'm glad I got a nose job. It's been almost 2 months since I got my nose job, and only last week I looked in the mirror and felt like it was my nose. I didn't look in the mirror trying to like see like, oh yeah, how's it looking today? So it does take a while to get adjusted. But yeah, I'm really happy with my nose. The week after my nose job, actually a week, 2 weeks after, I hadn't sneezed yet. Not once. And I was actually really nervous to sneeze. And they suggest that if you're going to sneeze, sneeze through your mouth. Which sounds really weird, but it's possible. You just have to basically, when you're about to sneeze, leave your mouth open and it'll stop right there. I can't fully like blow my nose, but what I'll do sometimes is like I'll take a cotton, like a tissue, and like hold one nostril and blow. I have dissolvable stitches and some of them still haven't dissolved, and it's been 2 months. My doctor just said they're going to dissolve, so just kind of like leave them. They're not really bothering me, but I just see them sometimes. So, nose job, I am so happy that I got it. This is 2 months post-op. Still swollen, but I'm okay with it. I love it so much. And if this is the right move for you, then I hope that you make the right decision, and I hope that you're happy, because I am personally so happy with it. And yeah, let me know if you have any questions. You could find me on Instagram, alethal. DM me. I know I was DMing YouTubers like, how long did it take you to leave your house and things like that. So feel free to DM me, follow me, and yeah, I hope that you enjoyed this video, and I hope that you have found what you're looking for.